So hi everyone, welcome to this first interview with me and my good friend, Dr. Rachel. She's also a naturopathic doctor. I'm Dr. Amber Knott. I work in Calgary, Alberta, and I have a passion for teaching people how to make lifestyle changes using mindset shifts and what I like to call mindset medicine. So I run an online course called that. I'm going to give Rachel a moment to introduce herself.
All right. Hello, everyone listening. As Amber said, my name is Dr. Rachel Fobert, and I'm a licensed naturopathic doctor in Ontario, Canada. And I have a big focus in my practice on gastrointestinal disease and dysfunction. So I really work with my patients on trying to get them to understand what their body's doing, why it's reacting the way it is, so we can focus the treatment on actually getting them some relief, but also getting healing and then stability. So in the future, they're getting maintenance of the benefit while they're still living their life. And I do this with a really big purpose, and that is liberation in their health. So I really don't want my patients to have their energy being taken away by bloating, by gas, by the fear of not being able to leave their house. So that's what we work on, so that they can take that energy and live their life really authentically. Because when you are grounded in your truth, you can reach and you can grow, you can expand, and you can take space in this world the way that you want to on your own terms. And I truly believe that that's healing and that's well-being. So that's why a little bit about why I show up and what I do.
Ah, fantastic. And it's so great that because that's kind of, what we're going to be talking about today. And I love how you related that back to your truth and to a deeper meaning and a deeper purpose. That's what I love. I love that stuff so much. So today we're going to be talking about the gut brain connection and how that relates to, so the brain aspect of that would be stress, and then the gut aspect we're going to focus in on the microbiome. And Rachel is such an expert in this area, so I'm so excited to talk to you about it. I really want to hear what you have to say. So why don't we start off by talking about what the microbiome is for anyone who is unsure?
Okay, I'm going to try and make it as clear as possible because I know there's a lot of misconception and things like that out there. So, a microbiome is essentially a community of microorganisms. You have multiple microbiomes in your body. You have one in your gastrointestinal system, you have one in your vaginal canal if you are a woman, and you also have one on your skin. So, there's lots of different microbiomes, and today we're really going to focus on your gastrointestinal microbiome. And what it consists of is around 38 trillion bacteria, fungus, and parasites that are supposed to be there. So that's called a commensal. That means it's meant to be there, it's providing you some benefit. And that's not always talked about. Your microbiome and the bugs that are in your microbiome are not pathogenic, meaning they cannot cause disease unless they're overgrown, and they'll cause symptoms, but you will not actually get sick with an infection. So I think that's a good clarification to make. And I just really wanted to say that your microbiome starts from when you are born. Your placenta had a microbiome in it, and that's a big piece of starting off your microbiome, as well as your mother's vaginal canal and the prebiotic fibers that came from the breast milk. So this is where your microbiome starts, and then it interplays with your body and different organ systems throughout your life.
Yeah, I think that's such a great point. I was on the ped shift when I was in school, and there's such a big and more research coming out on this too, on how important it is in the early phases of life to maintain that microbiome, because yeah, there can be some things that really affect it, and that could affect you longer term in your life. So I'm glad you mentioned that as well. And the fact that it's a good thing to have these bacteria, like they're important. I feel like people hear bacteria and they get, a little bit turned off from the idea of it. But yeah, maybe you can talk a little bit more about how the microbiome plays into a brain connection, and maybe what that connection is for people.
So that gets talked a lot, the gut-brain connection, and there's a lot of information out there, and I will say that scientists and researchers even don't have 100% lockdown on what's going on, because the body is so magnificently complex, and we may never know exactly what's going on. But I can kind of give a breakdown of of what the system is. And I just want to start off by explaining your nervous system because it's a key component. So we often get taught things like fight or flight, rest and digest. That is a part of your autonomic nervous system that's responding to stressors. So your sympathetic system, that goes on when you're stressed. That's your fight or flight system. It stops your digestive process. So if you're in fight or flight and eating, it's going to cause some gastrointestinal disturbance. Then you have your other side that is parasympathetic, and it's rest or digest. So this is when you've got digestive enzymes secreting, you can actually digest your food, and all's well in your gastrointestinal system, hopefully. The cool thing about it is they can both be active at the same time. So you can't have one or the other. One can be higher acting than the other, but they can both be there at the same time. So when you're really trying to modulate your nervous system, you need to be treating both sides. You cannot just be treating parasympathetic side because that makes you digest food without actually actively trying to work on your sympathetic system as well.
Right.
Because your GI tract gets input from both. So that's kind of how your nervous system plays in, because your nervous system is also connected to your brain and your gut. But what's crazy is there's also a lot of links towards your immune system actually being one of the key players in modulating the gut-brain connection. So that's things like inflammation and cytokines, which are things that are secreted when you're in an inflamed state. So they can impact your brain and your gut. And we see that in things like IBS and inflammatory bowel disease.
Wow.
So we know there's a bi-directional communication, and there was a really cool study done. So your vagus nerve, that's the connection between your brain and your gut on your parasympathetic rest and digest system. So majority of the fibers from your vagus nerve are going from your body into your brain. About 20% are going out from your brain to your gut. And that was really linked in this one study. They followed 2,000 people and they checked, did you get gastrointestinal symptoms before mood disorder or mood disorder before gastrointestinal symptoms? So 2/3 of people actually had gastrointestinal symptoms before the mood disorder, and 1/3 was vice versa. So it doesn't really explain which one came first, chicken or egg, but we know that there's a communication and one can impact the other.
That's a good point, because sometimes we forget, we think about it's one way, like this affects that, but really they're both communicating with each other. And that's important to understand because, yeah, for some people it could be one way, and for other people it could be communication the other way that's causing any issues. Let's talk about a little bit more about stress and how that plays into, you can choose the immune role or the nervous system role.
It's hard because they're both connected. The nervous system and the immune system can impact each other as well, which is why this can get a little bit crazy and why sometimes you have to like really break it down. Like I do it on a piece of paper just sometimes so I can like visually see what's going on with patients. So stress, we tend to believe that and talk about stress as if we're cognitively aware of it. So when I ask somebody if they're stressed, they often say no, because like even though they're living their busy life, they're managing their stressors really well. So cognitively, they're like, no, I'm doing good. That's not what stress means to your body.
Yes.
So unfortunately, it's not that simple. Stress can also mean inflammation. Stress can also mean insulin resistance. Stress can mean infection. Those count as stressors to your body. And stress can also mean mental, emotional. So we do a really good job at, we're in front of a stressor, so we manage it, we get rid of it, and then we move on. But what happens is the exposure to that stressor pushed us into that sympathetic fight or flight like side of your nervous system. And if you don't do something after to push yourself back over, or for some reason your nervous system isn't able to modulate that, your nervous system does not believe it's safe to be in rest and digest, then your body's still acting like that stressor is in front of you. So this is what stress means. And I think that's really not well communicated generally. So I wanted to share that first.
Yeah, that's a good point because so when it relates back to the microbiome, stress impacts those bacteria and, yeast, fungi, whatever's in there. How can it negatively affect it? Can you speak to that a little bit more, or what do you think?
Yeah, so stress, there's not a ton of research in terms of stress specifically reduces this microbe in your gut. What it does do is impacts your immune system, and it can change the diversity of your microbiome. And you need that immune system and you need that diversity in your microbiome to protect you from having commensal overgrowth. So overgrowth of the things that you want there. So stress can obviously be impacted by your vagus nerve. That in itself is a concern because it can cause a reduction in terms of your gastrointestinal mobility, as well as if you're actually making adequate amounts of neurotransmitters. So neurotransmitters are a big piece of your gut, and this is how stress kind of begins to interplay with your entire gastrointestinal tract, not just your microbiome, because we can change the amount of stomach acid that we're secreting based on vagal tone as well. And then vagal tone can change the motility of your gut. Are you constipated or having diarrhea? And that itself impacts your microbiome.
Yeah, okay.
So that's how we see the changes happening.
Yeah, no, that's fantastic. That's really helpful, that learning about how those neurotransmitters can impact that as well, because that's something that, yeah, we haven't really touched on yet. So you mentioned some of the digestive changes that people could see. What other conditions or symptoms would people expect to see if stress is impacting their microbiome?
Yeah, so that's a good question. Everyone's really unique in terms of their responses. And a little bit of this is because of their genetics. Genetics can interplay how well you secrete and break down and remove things like adrenaline and noradrenaline. So that matters in terms of, are you having diarrhea, constipation? Oftentimes, I just see something has shifted. The first thing that typically changes is people's stomach acid. So you require stomach acid to be able to actually begin digesting your proteins in your gut, but the stomach acid release into your intestines also triggers a lot of the release of your pancreatic enzymes in your bile to break everything else down. So we see changes in stomach acid, and that will actually show heartburn. People who have heartburn are bloating specifically with protein. So a lot of people will start trying to avoid meat.
Right.
So that's number one thing that I see. So now we've got maybe a little bit of heartburn, maybe not, but some bloating happening. Is first impact of like stress on your gut system. And then things will shift below. So people will often see food sensitivities and progressing food sensitivities as an issue for them in terms of intestinal health. That is a big red flag that something is going on, as well as any type of change in motility. So realistically, you should have 2 to 3 bowel movements a day. You shouldn't have to strain. They should be one log. That's what I'm looking for a healthy system. If anything like that has shifted or maybe never existed, that's also a really great marker to know your gastrointestinal system has been impacted. And honestly, I'm yet to see someone who their gastrointestinal system has not shifted because of a stressor or because of stress.
Yeah.
So it's always everybody's root cause in some way, shape, or form, whether it's mental, emotional, infection, inflammation, insulin resistance, whatever it is.
Great. Okay. So now I'm sure everyone's kind of thinking, how can we be evaluated? How, as a naturopath, can you help people who are experiencing maybe long-term stress has caused these damages or caused these symptoms for them? And how, as a naturopath, would you go about evaluating them and their symptoms and, potentially diagnosing them with something? And then, yeah, we'll start with that much before I get into too many questions. I have so much I want to know.
Okay. We'll talk about testing. I think, is that what kind of you're aiming at. So
Yes.
testing can be really cool. We typically, and if this is accessible for patients, we'll run a stool test. So that stool test is sent into a lab, and the lab checks, what they look for is if they can grow the microbes on a culture, so on a little petri dish, but they also check PCR, so if they can get the DNA.
Right.
So that way we can be really sure that what we are seeing in the test results is actually reflective in your microbiome. So the testing is really well done. What it gives us is not only commensal, so it will give me your microbiome in terms of the 4 main phyla that we see, and levels that we expect in a range, for because the range is quite large, to see if your diversity, some things have overgrown or some things have undergrown. Some people's diversity is really low. So we see all the commensals, but it also shows me pathogens. So it will also check in terms of if somebody has a parasite, if somebody has any sort of other pathogenic like Campylobacter, E. coli, anything that we don't want there, because that's also often missed, right? That people are saying you have dysbiosis, you have SIBO. That's all commensal overgrowth or undergrowth, but that's not talking pathogens, and that needs to be ruled out before we just start like flinging things around and trying to change your commensals that might actually be totally fine. So the testing gives us that full list, as well as, are you secreting the adequate amount of digestive enzymes? Do you have inflammation in your gut? And are you making the right short chain fatty acids at the right levels?
Wow, that's fantastic. I think that's so helpful that a lot of naturopaths can can run these tests so that people, instead of, like you said, just throwing around treatment plans and testing things out, you can actually get more of a root cause answer of what's going on so that you can treat that more specifically. Now that you've explained how the testing happens and how people can get a better understanding of what their root cause is for either direction, and most often these things will occur together, like you're saying. So the stress and the dysfunction of the gut is going to happen hand in hand. And so what kinds of things would you recommend to people, maybe just your top however many things you want to give us, for protecting your microbiome and keeping things, functioning at their best?
Yeah, that's a good question, because I think they come in, they're so focused on their symptoms that they don't think about, how am I going to maintain this afterward? It's like, how do I maintain the stability of my microbiome? Because you're still going to live your life, you're still going to experience stressors, and you're still going to react sometimes instead of responding, and no one's perfect, right? So how do we stabilize that so that your microbiome isn't shifting again in 5 months from now? So there's a couple of really awesome things that you can do. And I think this is a really good time to talk about how supplementation needs to be done with somebody who understands what's going on. And I'm going to give it in the explanation of vitamin D. So vitamin D is really great for microbial diversity. The higher diversity you have in your microbiome, the less susceptible you are going to be to these things. It has been pretty well established in the research. So we know you want high diversity, meaning a lot of different types of microbes, not just a high number of them. So vitamin D, awesome for diversity. You need vitamin D sufficiency. It's also anti-inflammatory. So we need to always make sure we have reduced inflammation so that your microbiome can feed itself. So we need vitamin D. A lot of times people are deficient, and we supplement it in really high doses. And what high dose supplementation of vitamin D has been shown to do is reduce the amount of vitamin B5 that your microbiome makes. And your microbiome needs B5 to maintain its diversity and its stability. So now you're giving yourself really high doses of vitamin C to try and protect yourself, right? It's great, you need it if you're deficient, but you've thrown off the stability of your microbiome.
Yeah.
So this is like a really good thing to know in terms of supplementing and like taking what I'm saying and saying, okay, I'm going to take this to somebody who can help me and guide me through this, is really important. So with that being said, B vitamins and B complex has been shown to stabilize the microbiome and maintain its diversity. And the cool thing is that your gut is on a circadian rhythm. So there's actually been shown to be improved sleep quality when you stabilize the diversity of the microbiome with B5 and a B complex, which is super cool.
Wow, that interacts with so many areas. I'm so glad you brought that up because I really wasn't expecting you, honestly, to talk about vitamin D and the B complexes. So that makes me so happy because, yeah, it's true. It's true. It needs to be talked about that seeing the right person to make sure that you're not, depleting something else or impacting another body system with what you're taking to raise something else up. Yeah, you need to be working with professionals when you're doing these things. So I'm glad you brought that up.
Especially like when we're tweaking these little things in terms of stabilizing, right? Like you don't have mass symptoms anymore, but you're just trying to protect yourself. You don't want to now put yourself at risk for something else for no reason.
Yeah, that's a good point.
Yeah, vitamin D with B5, awesome way if we're trying to maintain stability. But another really, really great free, well, I mean, not free because you got to buy food, but like something in your control is actual fiber diversity. So less one specific type of fiber, but diversity of fiber in your diet. And the best way to do this is just by eating a wide range of whole foods in your day. And the really interesting aspect of this is through all the research, there's no one type of fiber that's specific to increase one specific microbe, right?
Right.
So we do all this testing, something comes back low. And there's no one fiber for me to say, I know exactly what you need. I can give you this fiber to increase just this one. It increases everything. So there's no specific fiber. So the diversity of the fiber allows you to maintain the balance between everything that you want instead of overgrowing one commensal or undergrowing another.
Right.
What the fiber does is it feeds the microbes. And the microbes can then feed each other, which is pretty cool. So some of them feed off of part of your gastrointestinal lining, some of them feed off of the prebiotics, some of them feed off the B vitamins, and then they feed each other. The ones who can't make food feed each other, and that's how it kind of maintains this cool community, and why you want high diversity instead of one really high and one really low, because then we're not feeding each other, and that's how things kind of go out of balance.
Fantastic. Okay, so wide diversity of plant-based fibrous foods so that you can feed the gut.
Right. And then a really awesome way to look at your diet is that it can also be really anti-inflammatory. So like we originally talked about, there's that huge connection between your immune system and your gut and your brain. So we want to make sure that your gastrointestinal system is not inflamed. And that's how we make sure that we don't have a ton of stress reactivity causing gut reactivity and vice versa. So diet can be so anti-inflammatory by just eating a high-colored diet. So making sure every day you get in as many colors as possible. And you know what? Your coffee counts as a color, right? Like I count that as like black, purples, blues. Coffee counts as a color, but track your colors in your day because you'll be surprised at how many you're missing in your diet. And they're so anti-inflammatory.
Yes, that's so important. And they're different. Yeah, like that's why the colors are so important, right? It's different forms of anti-inflammatories within the colors of each one. And yeah, eat the rainbow.
Yeah, exactly.
Fantastic advice.
So those are your main things. And I mean, obviously there's some other tweaking things. You can certainly create like a thicker mucus lining in your gut, especially because you have a lot of microbes that feed off of it and require it for food. But as long as you're getting adequate nutrients from whole foods, and I mean, if you're really sticking to having a massive amount of whole foods per week and making sure that you're getting in all the colors, you should be getting sufficient levels of things like zinc that you need to make sure that your gastrointestinal lining stays healthy and able to feed and maintain that diversity that we want.
Yeah. Fantastic. Is there any other lifestyle stuff that, is there any other lifestyle things that you think you would want to potentially include in, helping people to maintain these levels of anti-inflammatory gut situations?
Yeah, of course. So, lifestyle stuff. So, we kind of went like nutrition supplementation, but in terms of lifestyle, meditation has been huge because it can modulate your vagus nerve and your stress response, right? So, that is very, very well shown and very well proven to change the amount um, of activation you're getting in your amygdala, so your fear response your fear response part of your brain, which like interacts with your adrenals and secretes your cortisol and your stress hormones. So we know if we can impact our amygdala, that we're impacting our stress response. So you've got meditation, another really awesome one that's shown to work with your parasympathetic nervous system is breath work. So you can actually activate your vagus nerve through breath work. Like, this is all under your control throughout the day, which is so cool about it.
Yeah, I love that.
So those I would say are the two most potent ones that you can do throughout the day.
Yeah, to learn how to manage your stress and learn how to have more of that control over the inflammation in your body, because we don't have control over everything, but of the things that we do, it's so important to take advantage of that and really use it to your advantage. So those are fantastic.
Yeah, and I think it's like empowering for people to know, hey, like, I can do this. Like, if I just take the moment to be aware, I can change this right now. And I think that's empowering, and it gives a lot of people hope, knowing that that's how I can heal myself now, but also how I can maintain it in the future, right? Because we know there's that bi-directional impact. So if you're reacting to everything and hyper-reactive, and this has been shown in cases of IBD and IBS and other functional gastrointestinal diseases, that if you're predisposed to reacting instead of responding, then like you're going to have a massive stress response, and you need to protect yourself a little more than someone who's not.
Mm-hmm.
So these are things in your control.
Yeah.
You can do it.
That's so fantastic. So protecting both your stress response and protecting your gut with the foods that you're putting into it, the inflammation that you're causing in that area, because like we said, there's that give and take from each end, from your brain to your gut, from your gut to your brain, and they both impact each other. Yeah, it's up to you. Any other management things that you would say to help people maintain a healthy microbiota?
I mean, it's honestly that simple.
Yeah.
If your microbiome right now is healthy, then it's that simple. Is like maintain like fiber diversity, maintain your anti-inflammatory foods, make sure you don't go vitamin D deficient, but if you are, don't give yourself massive doses without B support, and actually learn how to regulate your stress response and what's actually stressing you, because that's massive. And we see it, like there's mood disorders that we've seen linked to that, right? So It is that simple, but I will also say you can have a dysbiotic gut without having many gut symptoms and sometimes not at all, but you will be having mood changes, right? So it's hard to know who has a healthy gut and who doesn't. But if you feel well, then it's that simple.
Yes. Yeah. I love that so much. That's true. And yeah, it's important to mention that too as well. Yeah. Because sometimes the reason we talk about this give and take from each area is because sometimes it does only present in one way, even though it's being caused by another system that isn't showing symptoms yet. So yeah, that's a really great. And like you said earlier about how some people, you ask them about their stress, but they don't even really realize that they are stressed because it's become such a normal part of their life and of how their day goes. So, and that can impact the gut in return without them really realizing that that's what's going on. So,
yeah, we've become the masters of like shoving everything down. You know? Like, wow, that stressed me out, but I dealt with it, like shove it down. And it just doesn't work long term because you're not actually doing anything to re-regulate your nervous system, and your nervous system at some point will not feel like it's safe to be in the rest and digest, the thing that you need to actually allow your digestive system to function and to not predispose you to this dysbiotic gut, or not predispose you even to pathogens, because that can also happen. Right? So
yes, all of it's important, and it's all so well-rounded, and I'm so glad that you have been here to explain to us what that connection is, and also how different areas of your life affect that connection, and what you as a naturopath can do for people to test to make sure, well, what is it that's going on? Is this the cause or not? Because lots of things can impact the gut, and lots of things can impact your mood and your mental state. So yeah, there's a lot of different areas that should all be considered and looked at in all rounds of treatment plans, so that's very personalized to each patient. So
yeah, and I think like the microbiome has become like this fancy thing, and everyone wants to know about it. And like when you have symptoms, you want to know what you can do, and like the new best thing that comes up, you like really focus on. But I will say that not all gastrointestinal symptoms are microbiome caused, right?
yeah.
So sometimes you just don't have enough stomach acid, and that's all. And it's really important to have someone actually assess that, because you could be spending years and years and years and years of like buying supplements and self-treating and all of that kind of stuff, and you're not getting anywhere. And that makes you feel really defeated. It makes you feel really hopeless, and you shouldn't feel that way. I mean, the biggest thing to know is like there's someone out there that can help you. Like, seek that person out. You shouldn't have to suffer every day. And like I said at the beginning, spend your energy and eventually cause stressors by being sick.
Yeah, that's fantastic. So I'm glad we can let people know that there are other options, and there are testing things that you could do to get to the bottom, get to the root cause. That's what naturopaths do. That's our thing. We'll sit with you and talk to you until we get to the bottom of it, or we'll do some testing.
Yeah. We'll keep digging.
Yeah, we want to find out what it is, because we know how important that is to you and how life-changing it can be for you to actually remove the root if it's possible. So all right, well, how can people get in contact with you? How can they see what you're talking about? Tell us your website, your Instagram.
Good question. So mostly through my website and Instagram is how I'm functioning right now. So my website is rachelfobert.com, and I am also on Instagram as Dr. Rachel Fobert. That's where I share most of my information and little bits and pieces about my life, but you can always click the link in my bio to sign up and make an appointment there. Or if you're concerned and you want to know more questions, you can always direct message me.
Ah, fantastic. And yeah, it's true. I learned that vitamin D thing you were talking about earlier, about how important. I didn't know that relation to the gut, though, that you brought up today, because you had said on Instagram about how all these patients you're testing, it's summer right now, and they're all coming back vitamin D deficient in their blood work. So
everyone, and it's so crazy.
Yeah. So yeah, go get to.
They're like, I spent so much time outside. They're all so confused. Yeah. Because if you're vitamin D deficient and you're only taking a maintenance dose of vitamin D, it's just going to keep you at your deficient level. Yeah. It will just not make you go up, but it won't make you go down either.
Yeah.
So, yeah, pride.
Well, thank you so much for sharing with us today. So reach out to Rachel. I'll put all of her information below the video. Yes. Thank you so much. And I'm sure you'll be back on soon, because we did talk about other topics. So
yeah, lots of fun topics. But thanks for having me. This was fun.
Yeah. Okay, we'll see you back again soon.
See ya.